Okay? We are on figure 14. An emergency recent activity function represented by a calculation of percentage by volume in accordance with standby equipment embodiment. So here, you have your E.R. recent activity, the volume percentage, the overflow status, available equipment, standby equipment. Standby equipment available in inventory, standby equipment available in rooms. Instead of having pen and paper, this will be readily available in real time of what you have in each department. Number 15. This is figure 15. A discharge patient history alert function that is available 24 hours a day, 7 days a week, monitoring the discharge of medical devices for timely sanitation and disease risk reduction management. You have your E.R. alerts, your 24-hour sterilizing period not met. That'll pop up if you scan a barcode, the equipment type, and then for newly discharged patients, you'll have a running tab on those. So, for example, if you work in a restaurant, patrons that are actually getting ready to get up, you can have that ready, newly discharged tables, your clean table. So similar to how a hostess would keep track of restaurants, the status of patrons in a restaurant, meaning the time they sit down, the time they had their appetizers and entrees, desserts, and the time they got up, and the fact that the table has been cleaned and ready to go. Restaurants serve as a good, the way restaurants function serves as a good idea for how the newly discharged patients would work and keeping track of inventory would work. So I'm sure that this can be done. Number 16. A function for assigned equipment history sources that records using patient name and ID, time, date, department, and assigned personnel. So assigned equipment history, you can see what patient is on which equipment, which further helps to use the EDX to prepare to sterilize. So if you need to, shelf life is out on something, and you need to go on ahead and start preparing your sterilization agent for that patient that's getting ready to discharge, then you would go on ahead and use the assigned equipment history and be able to see the department that's getting ready to free up. So remember how I was saying, at Walmart, the customer service may have a long line. Well, the ICU may be full, so you get ready to discharge ICU, and it's the weekend, they're getting ready to go home, they've been in there for a week. You have several patients getting ready to leave. You can look at the assigned equipment they have and see how much equipment that you're getting ready to have freed up, and get your sterilization team ready to sterilize that equipment, ensure that it either has the 8, the 12, or the 24-hour aeration period, and your chemical agents are ready to go. Sterilize that, process that turnover successfully by knowing your assigned equipment history. And if you go back, you can also see your newly discharged patients, so you should know what equipment you have available. And if you do not meet the 24-hour sterilization period for certain equipment and certain viruses and infections or microbial agents or whatever, then the alert will go off. So we would like to have at least a 24-hour turnover period. Some things can be turned over in 8 to 12 hours. Some require 24 hours, depending on the procedure, especially if you're using an autoclave or sending something through the wash and it needs to air dry. Figure 17. So, for example, if you were to wash your own clothes at home, you have certain items that you don't put in the dryer. You have to calculate that aeration period for those clothes to dry to be ready for the next day for you to go to work. Okay, 17. An equipment locator that uses a network data integration search engine to locate equipment by patient name and ID, and equipment in accordance with PHI protected standards. So you can search equipment, you can enter the barcode or scan it, similar to how you do a QR code on your phone, to be able to scan it and get the location for the equipment, especially if you see in the comments that a patient has an increased progression or they're getting taken from ICU to med-surg floor. They're no longer on ICU. They're no longer on precautions. So then you need to search that equipment, find that patient room, the new room they were assigned to, with the equipment locator, and go on ahead and give them their new and improved sterilized IV pump and bed and things like that. So, for example, in a hotel room, they come in, they make the room new every night that you stay there. So when they're transferred from ICU to med-surg, we're going to make the room new as a fresh transfer. Make up the bed, change the sheets, give them fresh IV pumps and stuff, make sure there's no feeding pump leakage all over the IV pumps, dried out, make sure there's no bloodborne pathogens on their equipment, and things like that. Okay. Number 18, a clinical resource embodiment containing OSHA approved MSDS chart and a telephonic access data source in accordance with the telephonic safety lines, a commonly asked question source, a sterile technique, and an equipment zoom capability feature. So one of my favorites, the clinical resources, the telephonic access with the H.E.R Verify phones. They can call directly. And then, also the H.E.R Verify line, the chemical safety line, the patient safety line, commonly asked questions, MSDS helpline, OSHA approved MSDS charts, equipment sterilization techniques, equipment zoom, commonly missed crevices, joints, and connections. So this is your resources for whenever you're going through your H.E.R verification process, verifying the equipment, room, patient, admission. Okay? You can go back and research more information. So if I have an IV pump and I forgot what are the commonly missed crevices and joints, I can go back and see that screw. Okay, it'll pop up in there. Okay, number 19. Here you have a clinical resource guide that contains equipment descriptions, recommended aeration times, zone precautions, and zone classifications for disease reduction safety practices. So this is basically the chart that I showed you earlier with the zone precaution and zone classification, which is in the maroon red. Standard contact droplet airborne, equipment description, critical, semi-critical, non-critical, 24 hours for critical, 12 hours for semi-critical, and 8 hours for non-critical. An example of those things would be like crutches. Critical would be something like an endoscope. Okay. Figure 20. Okay, is a function as a zoom peeper that access points of concentration during the sterilization for medical devices. It's always good to have hard copy backup because some things are not 100% reliable through the internet and through your Wi-Fi connection and things like that. So figure 20 is just the example of the zoom feature that I showed you earlier with the IV pump that I hand drew, focusing on the screw that can develop, blood can dry in the crevices of that. 21 is the snitch chart that I showed you earlier. And then figure 22 is an embodiment of the H.E.R Verify flowchart that describes the functionality. I showed you the flowchart earlier. If I go to the flowchart, it's right here. Starts right here. Medical device used or in use, body system and organ association, zoom feature, potentially contaminated equipment and instruments, type and aeration, critical, semi-critical, and non-critical, 12, 24, 8-hour period. Then you have the H.E.R Verify check methods alerts and the H.E.R Verify specialized techniques working together. The H.E.R Verify check method alerts guide you to the recommended sterilization chemical. The EPRA verified specialized techniques follow the FDA and EPA cleared brands, which leads you to the name of potentially contaminating pathogens and pathogen association, which then leads you to an EPRA verified equipment. You can use the mop, server spray wet mop, the with chemically interchangeable layers, PPE, precaution based. So you still follow the standard precautions of PPE based on what the United States has put in place. And then that leads you to the zone classification and zone precautions, okay, that you need to take. So it's just a flow chart of how it all kind of comes together. And of course, in the end, you would have a clean equipment. So utilizing all these features together, they're just this just shows how they're intertwined. This is not a step-by-step flow chart. Next, you have a sterile steam tackle mechanically. EPRA brands recommend sterile techniques. Isolate, let aerate equipment ready to bag, guide for increased safety that ensures all EPRA verified technicians will follow a standard protocol for several medical devices. This is a sterile procedure here. S stands for steam technology, T stands for tackle mechanically, E stands for EPRA verify, R stands for recommended sterilization techniques, I stands for isolate each piece, part, joint, and or crevice of equipment. L stands for let equipment sit for a 24, 12, 8 aeration time period. E stands for equipment ready to bag in reusable and washable polyethylene terephthalate bags. So those are biohazard bags. They're available at Walmart in the campus section. Those can be reused and can be washed to hold certain equipment. So plastic bags are not out of the question as long as the equipment is dry, but we also have certain things that need to be more safeguarded, and we can put those in biohazard reusable polyethylene terephthalate bags, which are very durable. Okay, so it depends on how heavy the equipment is and if it has sharp edges and things like that. Something that can pierce through plastic or would overweigh plastic, we would resort to the polyethylene bags. Okay? So that was the sterile. Now we're on the client metrics data sheet integrated into the department patient equipment usage tracker database. It just goes through EPRA verified client metrics, the version, the host, SNIDS, the username, EPRA verified email and password, Lex Enterprises help desk email, user settings, date time, direct care assistant, EPRA verified technician. Direct care assistant could be a nurse, a doctor. Lex Enterprises settings, date, time, the shift, and the client ID. Okay. Okay. Next is a reference point. Okay. Figure 25. Okay, a reference point for definitions, regulatory agency information in general, health, body, systems, interactions. So these are the alert definitions. Those are separate. Okay. Go on, save this to desktop. We'll zoom in here. Definitions consist of what we talked about earlier. Some common things that would be resourceful to know: what SARS is, MERS is, VRE, VISA, ESBLs, extended spectrum beta-lactamates producing gram-negative bacilli, a quaternary ammonia compound, a surface-active water-soluble disinfecting substance that has 4 carbon atoms linked to a nitrogen atom through covalent bonds. One thing is decontamination, the removal of all pathogenic organizations by the physical and/or chemical removal techniques. Equipment is unable to transmit infection to patients from the surface of contact. Antiseptic, substance that prevents the growth or action of microorganisms by inhibiting or destroying them. Asepsis, prevention of contact with microorganisms. So patients come in septic, we want to have asepsis, prevention of contact with microorganisms. No one is perfect, however we want to strive to be as close to perfect as possible. Spores, abbreviated SP, period. Remember, relatively waterproof round elliptical resting cell consisting of a condensed cytoplasm and nucleus surrounded by an impenetrable cell wall or coat, relatively resistant to disinfectant and sterilizers in drying conditions. We also have pyrons, viricide, lipid virus, PPE, integumentary, okay, the skin, protects tissues, regulates body temperature, supports sensory receptors. So, furthermore, we have another page. All the systems: cardiovascular, respiratory, digestive, urinary, muscular, nervous, endocrine, lymphatic, reproductive, skeletal. Morbidity is the incidence of disease. Mortality is the number of deaths in a given time or place. So, we want to prevent mortality and decrease morbidity. And that's going to be it for the definitions. So we're stopping off on figure 25, a reference point for definitions, regulatory agency information, and general health and body systems informatics.